You are watching Access LaPorte County Channel 97. Coming up next is the May 14th meeting for the Michigan City Commission on the Social Status of African American Males. You can find more information for this meeting by visiting www.accesslaportecounty.org.
Everybody, I'll go ahead and call the meeting to order for the Michigan City Commission on the Social Status for African American Males at 12:12. We were kind of waiting around to see if we would get a quorum today. It does not appear that we're going to have a quorum. However, we do have two guest speakers that we absolutely want to hear from today. So we will go through, we just won't be able to vote on anything. So let's go ahead and salute the flag. Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, roll call, please. Commissioner Moore, do you have a list?
I don't have a list, but I'll try to do my best. Willie Millsap,
Present.
Nick Pollitt,
Present.
Taylor Tillman, Pastor Hurt, excused absence. Robert Johnson,
Here.
Makia Smallwood, Laquela Cooper, Faye Moore, present. Stacy Bennon,
She is at work. Excused.
Walter Cox, present. Mike Jones,
Present. I know we recently had Danny Armstrong added to the commission.
so we have 6 present. We do not have a quorum.
Okay. Thank you. All right, so with that being said, next on the agenda would be the approval of April's meeting minutes, but we're not going to be able to vote on that. So we'll table that to the next meeting. Treasurer report, if you want to give the report, that's fine. We just can't vote on that either.
Of course, I didn't keep a copy for myself. Oh, here it is. Okay, so our beginning balance was $3,370.94. We had no deposits, we had no disbursements, so our balance is $3,370.94.
Thank you. Next is old business. I got a few things. I've been gone for about 2.5 months for work up in Canada. So I appreciate everybody that was here and handled the duties of the board while I was gone. Thank you for that. And Commissioner Johnson, you did a fabulous job at last month's meeting.
Thank you, sir.
Couple of notes. Obviously, there was no quorum last month, so I had to approve last month's treasurer report and meeting minutes. We can't do that. Next on my notes, I had Zoom or online capabilities to join in the meeting. It's something that I think is pretty relevant today, especially because a couple of the commissioners that couldn't be here today told me that if they did have Zoom access, they could have at least joined in that way. So I think, you know, that's something that's been a priority of mine since I started, was to make sure that the meetings are accessible by everybody in any means necessary, especially considering this is 2025. We should be able to have those types of accessibilities to the meetings. So I think next month we may look at maybe going to the Alco Studios so that we can have online access to the meetings. So when I do the agenda for next month, just keep an eye on the location and we'll try it out. I noticed during the last meeting, we mentioned a formal letter to the city council for funding. So I have that in my notes under old business, so I will start working on that. Is there any other old business that any of the commissioners have? Nothing? All right. New business. As I said earlier, we have two guest speakers today. We have the Swanson Center here to talk about mental health in the Black community. And we have Mr. Virgil Giles with the director. He's the director for the Indiana Commission on the Social Status of Black Males. I'd like to thank both of you for being here today. And the Swanson Center was first on the list, so you are first to present.
Well, thank you very much for having us, first of all. I'm Jennifer Heath. I'm the director for the Foundation for Behavioral Health at Swanson Center, and I brought with me today Esther Stiles, who's our employment, staff development, and community liaison. And both of us came today as representatives of Swanson Center just so that we could get out here and tell you a little bit about mental health in the African American community, with May being Mental Health Awareness Month. To start off, I will say that I'm not clinical for the representation of Swanson Center, so if you do have any questions that are clinical in nature during the presentation, let me know, and we can get you in contact with someone at the clinic itself who maybe can answer that question a little more expediently and better than I can myself. So just know that as we walk through this. Each of you should have some handouts in front of you. Not only do you have both mine and Esther's business cards, along with a brochure from Swanson Center, but you have slides of my entire presentation there, along with some gifts that we brought, and a green ribbon. The green ribbon is for Mental Health Awareness Month. We all wear little green ribbons on our lanyards at work, and they're really meant just to kind of start the conversation surrounding mental health awareness. So when you wear it and someone says, what's that green ribbon for? You can say, oh, well, that's for Mental Health Awareness Month. Let me tell you a little bit about it. And so hopefully today we'll educate you a little more. And if you have more questions or would like more information, again, please be free or feel free to reach out to us. So to start off, in LaPorte County, about 10.4% of our population is African American. In the state of Indiana, that figure as of 2023 was about 10.3%. And throughout the entire United States, about 13.6% of Americans, or 45.3 million, identified as Black or African American. According to the Office of Minority Health, approximately 19.4% of non-Hispanic African American or Black adults experienced mental illness over the past year, which suggests about 1 in 5 are affected by this. Depression rates indicate that depression amongst African American or Black men specifically ranges from 5 to 10%, according to the National Institute for Health. A study publication from the University of Michigan that I found reported that African American or Black men aged 18 and older have a lifetime prevalence of suicidal ideation at 10.2% and suicide attempts at 2.7%. So people are out there just screaming for help. They absolutely need to be heard. Despite these facts, African American or Black men are less likely to seek mental health treatment due to such factors as stigma, systemic barriers, and lack of access to culturally competent care, meaning they don't feel like there's somebody who really understands their specific issues that they bring forward. So they don't feel like there's someone who can relate to them on their same level. If you go to the next slide, you'll see the 5 stressors for Black men that I found on reclaimourstrength.com, where they cite the 5 main sources of stress amongst Black men that are mainly cited are money and finances, race and racism, jobs and career, relationship and family, or health and illness. And to kind of follow up on that, untreated mental health disorders and unmanaged stress are really silent killers. So there are things that if they're not talked about, they can really have a detrimental effect, not only on your mental health, but your physical health. Adult Blacks are 20% more likely to experience serious mental health problems compared to the general population, and only 6.6% of Black men have used mental health services in the last year, and that's according to the U.S. Department of Health and Human Services, Office of Minority Health, with a study that they did on mental health in African Americans in 2016. Great slide, and I wanted to make sure that you guys saw that one specifically, because it's a great website to go to if you have a minute. Some key challenges in seeking mental health care are underutilization of services. So Black men are less likely to seek out mental health treatment and often receive inadequate care. Disparities in stigma, systemic racism, economic and educational disparities, and social injustice contribute to mental health challenges and stigma within the Black community. And the alarming suicide rates, which is the third leading cause of death for Black men aged 15 to 24. In 2018, the suicide rate was 4 times higher for Black men than that of Black women. 4 times. And so, because I don't believe in bringing you a problem without a solution, going forward, practical solutions that we have that we can use are addressing the personal biases, being encouraging clinicians to recognize their own personal biases and mitigate their own personal biases to provide equitable care. Community engagement, so building trust in community-based programs through outreach with things like this. Having culturally competent care, implementing mental health services that are sensitive to cultural differences and experiences. And most importantly, in my mind, is representation in the mental health fields and increasing the number of Black mental health professionals to reflect the communities in which we serve. And beyond that, really keeping the conversation going. So again, these green mental health awareness ribbons, letting people know that you too support mental health, that you're open to the idea of seeking mental health treatment or encouraging others to do so. So making sure that they know that it's available, that it's out there, that there are people who care and want to listen. Whether it's with a therapist, at their barber shop, wherever it might be, just to get them talking. And then lastly, I've got a few pages of resources there for you, and I tried to put at least a little summary of each there for you as well. And so I'll read through the resources, and you can read through the descriptions on your own. NAMI, which is the National Alliance of Mental Health Illness, Black Mental Health Alliance, Black Mental Wellness, Ourselves Black, which is a biannual magazine, the CIWI Project, and the 988 Lifeline. And if you don't know about 988, that is the Suicide and Crisis Lifeline. It's a free 24/7 confidential hotline that people can call to get help. And that's through the U.S. national government. So that is through SAMHSA. And they can call or text by just dialing 988 and sending a message. So it's nice that you can do it either way or through either modality. You don't have to make a phone call. If you're more comfortable with a text, they can send a text as well. So for that younger generation that maybe doesn't want to make a call, they don't use their phones to call. It's all about whatever else they can do. And send a text as well. And with that, if you have any questions for us, we're happy to field a few questions for you.
I do have a question.
Sure.
Because on your key challenge, you talk about the alarm suicide rate. Why isn't that the case? What kind of study was done on that?
So the things that I found there, those were all from the National Alliance on Mental Illness, from NAMI, on the study that they did. I don't know what the reason is for that. I don't have that answer because I'm not clinical, but I can find that out for you and get back to you.
Okay.
I'll be happy to get that information to Willie.
That study.
So I can send that to Willie or to Ms. Faye for you.
Okay, because that's important that we understand
The why.
the alarm of it, because there's many factors that plays into
There
it.
are, and if you go back to the slide before that, it's all the stressors, and it's people that either, so when you're talking about suicidal ideation in general, a lot of it is that people aren't heard. So they may say that they're thinking about it, or they may not say that they're thinking about it. People can put up a false front really well and then go home and you don't know what they're dealing with at home, right? So on that back side of it, with the parts that you don't see that maybe aren't as bright and cheery as what you see at face value, there might be a whole different situation that you don't see at home. But there also might be a serious cry for help that maybe someone isn't hearing. And that's where that comes from.
And the reason why for my question, if I can be transparent,
Please.
I almost went through that. Maybe some 20, maybe longer than that, maybe 20 or 30 years ago, because of a situation that I was involved in. And when you don't know how to handle it, with all that compact atmosphere, you go through whether it's worth living, is it getting out of here, staying around. So that's my reason for answering that question, because most of the time, we look at, you have somebody in the community that you can talk to. We refer them to your pastor, we refer them to this. But when you don't have close associates, it makes it very difficult. So that's why I really wanted to answer that, ask that question.
I will see if I can find out for you, and at the bare minimum, I will send the link.
One thing is for certain, two things for sure. Anybody ever learned a lesson from suicide?
I can't dispute that. I will add to that we do have a phenomenal system of pastors that are here in the community. They're all willing to listen and all willing to help. And then our barber shops as well are another system of individuals who really care. And I know that there are already initiatives out there. I know Franciscan has one where they do a day with the barber shops, specifically the black barber shops, where they have a day that's centered around this issue, not just mental health, but they've already started an initiative through Nyla Williams that helps with that as well.
Well, to answer that question, I learned something from it.
No, you didn't complete it.
No.
So I'm saying, you didn't complete it.
I just
Yeah.
went through it.
Jennifer, Esther, thank you for being here today.
Having us.
For our viewing audience, could you please share the information with the Swanson Center? If anybody that's viewing our meeting have a family member or loved one that's going through something at this time, that they can
Of course.
contact you by?
Of course, they can reach out to us on our website. It's www.swansoncenter.org, or they can call us at 219-879-4621. We have offices in both Michigan City and LaPorte, and we're happy to help at either office.
The office in Michigan City is located where?
On 400 North.
400 North. Is that on the bus route?
Yes.
Yes.
Yes, it is.
Bus stop right up front.
Questions?
Yes.
So, do you guys do anything like labor organizations? Have you guys communicated with contractors or communicated with different labor
So we
organizations?
haven't, not specifically with labor organizations, but we'd be open to doing so.
I say that because in the construction industry, a lot of times, as a representative of carpentry, I've come across many situations of people just need somebody to talk to. And sometimes I find myself having an hour-long conversation, just trying to, just bend that ear that they need, because I
Right.
get it.
Right.
Because last year I lost a cousin of mine, and I didn't see the signs, and it blew my mind. And within that same week, I had 3 individuals, 2 parents reached out to me to get help for their kids that was in the industry, and just having for people knowing the resources that's out there, like people need to know this stuff. Like what he was saying, people don't know who they can talk to or what resources out there available for them to speak to. But where I'm going at with this is, if you guys are not doing anything with like the different trades, definitely I would highly recommend reaching out to the different trade labor organizations, because in the industry, we're working around the people out on the job sites more than we're around our family
Right.
members.
Absolutely
That's the
true.
sacrifice that we make.
It's
And a lot of
absolutely
us
true.
body that stuff in, so we need to know about these resources out there. So think of
That's
what creative ways of creating a hard hat sticker, so people can put that information, the calling information on their hard hat sticker.
Thank you.
The person can put it on the back, so the person behind them standing might read it, and without saying anything, they might take that information down. So that's something to consider too as well.
And you guys do tend to collect a lot of those stickers.
I
on your
love
hats.
stickers. That's why I love stickers. But thank you.
Thank you. I appreciate that. Absolutely.
What are some of the signs? Could you tell me what are some of the signs? You go,
Esther, you want to field that one?
Yeah, so I think isolating, if you're getting quieter and not talking to your sort of normal group of friends or family. Other signs could be if you're giving away belongings that are really important and sentimental to you, but you're just sort of, all of a sudden giving those away to other folks. Statements of like, I can't do this anymore, or I'm just too tired, or what's the point? Some of those general statements that, we could assume are specific to, stress or frustration, but also really could be a bigger sign of feeling that, some of those suicidal thoughts, for sure. Those are the top couple that come to mind for me. It's just that isolation. Triggers for that could be a loss of employment, sudden loss of employment, divorce, loss of someone close to you. So feeling that loss as well, and not having, or feeling like you don't have someone that you can reach out and talk to. Yeah, those are a couple. Yeah. There is on the back of the brochure too, the after hours crisis line. So Jenny offered our agency number, but we do have a 24-hour crisis line, 219-871-9975. So that's answered 24/7 by our management staff.
Wonderful. I think, I've always heard the stigma, especially with males, is very difficult for men to open up,
Yeah.
right? We want to bury everything inside and not talk about it because we're macho. But I know I have 2 friends of mine who have committed suicide over the years, probably for that reason, because they couldn't talk about it. But I did notice on here, the stressors, and I'm no clinician, but I'm a firm believer that money, or the lack of money, starts all these, right? So money and finances, jobs and careers, relationships. I feel like, unfortunately in this country, and this is why I love doing what I do. I love giving people the opportunity to have a career with a living wage attached to it, because in this country, too many people are living paycheck to paycheck or can't even do that, right? They're at the poverty level and they can't afford things and they don't have extra money and they have to cope. And that leads to either alcoholism, drug use, it leads to domestic violence, and ultimately it could lead to suicide, right? So I'm absolutely an advocate of pushing living wage careers. And unfortunately, there's a lot of people that don't want to have that in this country because it's all about the profits. But I think that would help a lot, you know, a lot.
Piggybacking off the financial statement, reference to a family member having issues and they call you, the funding or the cost, I think the correct term is indigent. Okay, how do you guys deal with that?
I don't know if I have an answer to that specifically, except to say that, you know, our services are a crisis line, and I know that lots of the national crisis line numbers as well, there isn't a cost associated with calling and speaking with someone in the midst of a crisis. I think the cost associated with that could be depending on any long-term recommendations for treatment, which usually get billed to insurance. I know that the agency offers a sliding scale fee, and generally speaking, as a community mental health center, we're not able to turn anybody away and wouldn't want to turn anybody away if they were in crisis. So there are avenues to help folks get access to insurance if they don't have it. But at the end of the day, we're there to help through a crisis and make sure that folks have the services they need, even if they're not able to pay for it.
So when they call that hotline number 871-9975, last thing the people need to worry about is the funding aspects.
100%.
Because you guys will make it work.
100%.
Thank you.
Thank you, good question. Same thing. Anybody else? All right, well, thank you, Astra and Jennifer.
Thank you very
Appreciate
much.
coming in today.
Yeah.
Giving your presentation, it was great. I think the more we talk about it, the less that it lessens that stigma, right? So we have to keep the conversation going.
And it gets our antenna up.
Yep,
So when we see this, we'll respond positively,
yep,
as opposed to just burying our head in the sand.
right. Good point. All right, I guess that opens the floor for Mr. Virgil Giles.
Good afternoon, everyone, and thank you for inviting me to speak to the commission this afternoon. Also, my new executive director, Jose Evans, sends his thanks as well, and he was just appointed to the commission as the new executive director around maybe 2 months ago. Before I get started, I also want to say that the Social Status of Black Males worked with Nyla Williams with our Indiana Black Barbershop Health Initiative this past April. And that's one of the things that we work on, and that's one of our major focuses now is men's mental health. And we've held several outreach events as it relates to men's health, and even had an outbreak session where men were open and talking about their feelings, and so that's pretty interesting. And I think that it's a great thing that now more news is, and more awareness is starting to come around men's mental health, especially for Black men. So I'm glad to see that, and the commission champions that, and will continue to make that a part of our mission. So, thank you. I had a few items that I just wanted to update the commission on. As you know, the state legislature just concluded their their budget session, and so the Cultural Commission has received a budget for the next 2 years. Our biennium in our budget cycle starts July 1st and goes to June 30th. So this coming July to June 30th of 2026 will be the first year, and then the second year will be July to June to 2027. We received a 5% pay cut over our last biennium. So that's roughly $7,500 that we lost. We would usually take that money and that would go into our general account. We would use that for some form of programming. So we won't have that for the next 2 years. So now we'll be looking at sponsorships from our partners to do a lot of our programming. So for each year, the commission will receive $128,659. So basically that money will go to my salary and then seat charges, so office space, cell phone, computer, things like that. So We're operating solely off of what we receive from our partners when we do our outreach and programming. So for the next 2 years, and this is what's interesting with the cultural commissions, it's not just the social status of Black males, it's the Indiana Commission on Hispanics and Latinos, and the Native American Commission, as well as the Women's Commission. We're all operating at a 5% budget decrease, but also Director Evans will have to demonstrate that the commissions are viable. And so the objective for the next 2 years is going to be to revitalize the commissions. And so that's one of the reasons why I'm here today. I've met with the Gary Commission. I'm meeting with you today. Next week I meet with Muncie and Evansville. And so what I want to do is start building up that partnership with the commissions and more or less see how we can work together, how we can support one another to provide our, to provide resources for Black men and education. The commission, we cover the entire state, so everything we do, we provide as a free service. And so, as I stated before, we work with our partners to provide these services, but we want to, work with you to see how we can help you, how we can support your mission, and the same with us. One of the things that we're doing this year, in October, we're having a conference that's basically supporting the governor's health initiative. And our theme is going to be restoring the village, advancing health equity for Black males in Indiana. And so what we're trying to do is, in October, provide workshops as it relates to healthy eating, diabetes, and heart care. That's it. If I'm going too fast, just let me know. I'll slow down and I can repeat anything. And one of the things that we were asking all of the commissions, and if you wanted to, if the option is available for you, that if you want to provide a workshop or participate on a panel and just discuss or provide information on what you do for Black males as it relates to healthy lifestyles and heart disease and diabetes. And if you also have any local vendors that may want to attend who provide resources, we're going to have an area where we have resource tables. And so if you know of some vendors who may want to participate in the conference, please let me know, and I'll work directly with them, and we can have them present at the conference as well. And as we do our planning for this conference, we wanted to include you. So if there's any feedback or any input that you wanted to add to the conference, we're open to that, and we would like for you to participate in that if you're able to. And we're looking as well with the governor's health initiative. There's like exercising and physical activity for students. And so if there's a school that you think that may be interested in attending, whether it's a grade school or high school, please let me know and I can work with them and see if they would be interested in attending. It's in Indianapolis, but we would have bus service and things like that, so that that'd be addressed as far as getting to Indianapolis. And then we're working with the Indiana Black Expo, and we're, as I said, it's going to be about eating healthy, diabetes, and heart disease. And so those are two things that we're going to be doing this year as a commission as it relates to the governor's executive orders. And then I wanted to ask you guys, is there anything that you're planning this year that we could be involved in and that we could support?
I don't know if we have anything planned moving forward. Other than
At our last meeting, we had a lady made a presentation of losing a loved one. Maybe
But you guys didn't vote on anything. Or
Right.
say that you wanted to do it.
Right, but as he said, he's just bringing new information that if there's anything that we're working on, that can be that theme. So,
But in the past, Mr. Jarrett always attended our back-to-school rally in Michigan City. And he would bring either those books from the annual report
Okay.
that were left over to hand out,
I know.
or any other information that the
Okay.
commission were doing. And the back-to-school rally,
And you have my card. Would you be able to send me information on the back to school rally?
got it, because I sure can't find it right now. I think it's the last of July.
Yeah, I was gonna say, I think it's usually the end of July or early August.
Yeah.
Yeah. I'm like,
So what do they do with the back to school rally? What do they usually do?
I'm sorry.
What do they usually do at the back?
Well, we usually will hand out some backpacks and with stuff in them.
School material, school
The last
materials,
year,
paper.
the last years we've done that. But previously, Mr. Garrett
Garrett,
would
James
hand
Garrett.
out the leftover books from the meeting, they used to do an annual report.
Yeah, we still do.
Whatever with
Annual
statistics in it for, about blacks and the youth
Yeah.
and stuff like that. So he would always bring those down, and we always had a table at the back to school rally, and he would hand those out.
And this is something you're trying to align with the initiative, the healthcare initiative?
Well, yeah, that's, when we met earlier, one of the things that the commission does, and there in the brochures that I gave you, we, not only do we address healthcare, we education, employment, criminal justice, and social factors. And social factors include anything like mental health, drug addiction, you're a new parent and you don't know how to feed your baby, change diapers, things like that. So it's anything that black males experience that may create an obstacle or they just have no idea how to do it. So that's what we look at as far as social factors. And so that's our mission. And so that's what we provide, like free resources and education throughout the state.
So I was saying that because everybody's from Michigan City in this room. Friday Night Lights at the high school. I think that's something like you guys commission might want to consider like getting involved with, because that's kind of geared around like a lot of different sports things. Promoting healthy living, like doing something with that. I thought it was a pretty cool thing when I attended that last year with Nick. Friday Night Lights. You got all these kids from, I guess, the surrounding community. They go and play tennis, basketball. They had a little section where they was playing, throwing footballs around. It's just promoting healthy living in the community. I think you guys probably should consider doing something with it.
But do you have the dates for the October conference?
We're narrowing that down now. Hopefully within the next few weeks, we'll have a location, date and time, and I'll get all of that information to Nick. And so,
And the
everyone
vendors,
has it.
will there be a cost for the vendors?
That's being discussed right now. I'm sorry, we're in the early planning stages, so it's a lot of like confirmed information I don't have, but that's being considered.
reference to that October date, is that anywhere near the Circle City Classic event?
The Circle City Classic event does take place in October, and we try not to
Right.
affect that date. So we let them confirm their date, and we work around Indiana Black Expo. That's one of our great partners, and so we don't interrupt each other's services.
Well, I was referring to tag along, like add to.
Oh, add two. Oh, okay.
Yeah, like if there's October 24th, 25th, or whatever, then you can tie on afterwards. Reason being is the attendance level is so high, you'll have more participants there anyway. So you could just add on to the event.
I'll let my executive director know that. Thank you.
Yeah. And who is the executive director now?
Jose Evans.
Garrett is gone then.
Well, I'm the executive director now for the
Commission.
for the commission, and Jose Evans is the executive director for the Indiana Civil Rights Commission. Our commission is an umbrella organization under the civil rights. And so it's the Indiana Civil Rights and then the 4 cultural commissions. It's the social status for Black males, Latinos, and Hispanics, the Women's Commission, and Native American Commission. So we're all under the Indiana Civil Rights Commission.
So the umbrella change came under the new
Yes.
election?
Yeah.
Oh, so under the umbrella, did the funding change?
Yes.
Which is why the cut is in place.
Correct.
Right. Wow.
Yeah, we was 5% increase across the board.
Decrease.
Decrease. Thank you. I'm sorry.
Big difference.
Decrease. Decrease.
Which is the umbrella.
Wow. Big decrease.
Okay. Oh, South Bend chapter. You was mentioning you were visiting other.
Yeah, well, I'm
communities?
just visiting South Bend tomorrow to do like community outreach and see if there's a possibility of probably starting a local commission. But I was in Gary last Wednesday. Here today, I'll be in Muncie on Monday and then Evansville next Thursday.
But South Bend, at one time, they did have,
No,
so South Bend was just out of the loop altogether.
correct.
That's odd, because we're in the same region.
Right.
Elkhart is right next door.
Yep, and Elkhart doesn't have one either.
Elkhart doesn't have one?
No, they have an Indiana Black Expo chapter though.
Right.
Correct. And we have one locally here in Michigan City chapter in the Black Expo.
Oh,
The chair is Pat Harris.
okay.
Okay. And I'll give you her number off camera.
Okay.
Okay.
And then also, is there anything that I can do, and not to put you on the spot now, but if there's anything that I can do to support the commission, please let me know. And that's, planning events, hosting events like a young lady said, James Gary used to come out and attend the back to school. And that's what we do. We'll provide a resource table and provide information about the services that we provide throughout the state. So just keep that in mind as you move forward with your planning. If there's anything that I can do to support the commission, please let me know. This isn't a one-time trip. So, and then if there's anything that, I don't know how you look at like increasing membership or anything like that, or awareness within the community, if there's anything that I can do, please let me know. If you have events and you want to share information, I can share it on my social media. We have a Facebook page and an Instagram page, and so I can share anything that you want to promote. I will share that on my page, and we'll get full coverage. We get coverage throughout the state, so I can assist with
great.
that as well.
Right.
And that's all I have for today.
Thank you so much.
You're welcome. If you have any questions outside of what you already asked, please let me know. Or if you want to talk afterward, I'll stick around and we can have some conversations.
Good.
Wonderful.
Thank you.
Thanks, Virgil. No, that's good. I will have some questions for you after.
All right.
All right, good stuff today. Next, we move on to our subcommittee reports, education. Pastor Hurt's not here. Does anybody else have anything? Education? No. Health?
Tonight, at the Michigan City Police Department, there will be a host of a prostrate workshop. Dr. Ranson, I've heard so much about him.
Nice guy.
And
Very good doctor.
he will be in charge of that workshop, and then he will even examine you at that time during that workshop. So that workshop will start at 6 p.m. At the Michigan City Police Department, 1201 East Michigan Boulevard. So 6 o'clock. We hope that many of the malefactors will come and be a part of that prostrate workshop, because you need to understand what's going on with your body. So I invite you to that workshop tonight at 6 p.m. Thank you.
All right. Anything else on health from anybody? Next is employment.
Okay. Commissioners, this week I have 4 possible employment opportunities for people in our community. Please be advised that all of this data that you're receiving is from Work One, our local employment agency in our community. They are located at 317 Detroit Street, the old Elston's school building. The main entrance, there's a door ringer that has Work One on it. You press that button and you gain entry. First one, reference to CDL training. This particular company is paying you to learn during your training program to get your CDL. It's very well recommended by the state. They offer healthcare, dental, vision, insurance, 401 matching K, paid vacations, and sick days, also holidays. Starting pay while you're training is $10 during the program. Once you complete the program, you assign a card, driver's license, or whatever to work for. Second one is Airmark, which is a food service for the Indiana State Prison. They are looking for workers. Starting pay is $18 an hour. Benefits, full health, vision, dental, vacation, paid holidays, college tuition, and free shift meals, and more. The third one is the current listing of job vacancies in our region, not just Michigan City. That is LaPorte, Porter, Chesterton, Valpo, etc. There's 2 pages. Some of the places of employment is Doolan School Administration, People's Bank, Edgewater Health, Hamet, which is in LaPorte, let's see, Frito-Lay, which is in Maryville. That's a good one. That's $30 an hour for a route sales representation. So look at those, share with your family, friends, and associates. If they have any questions reference to those slots, Work One, 317 Detroit Street, main entrance facing Detroit Street. Ring the buzzer on the door that's labeled Work One. They would let you in and you can talk to a placement representative there. The last one is not a job, it's a career. The Michigan City Fire Department is accepting applications for probationary firefighters. As a retired fireman myself, I think this is the key to success. So that's the application. I should warn you, it's a lengthy process. It doesn't happen overnight, but the results will change your life. Any questions? Thank you. See you next meeting.
So, I do have a question. So, we can just give this to somebody and they can fill it out?
You can fill it out. All the information is in the packet, and you can also apply at City Hall because it's a city job or a career. Just like the police department. And the CDL, I think, is a good program because you're getting paid as you learn. It's not a high pay, but it's enough to keep you going. Because at the end of the tunnel, you know, you'll have your job.
Yeah, and that commercial driver's license can go with you anyway.
CDL can travel along with you.
Is that just for Indiana?
Well, this particular company is in Indiana, but I'm sure
That's a nationwide
if
organization.
you have an Indiana CDL, sure you move to Illinois, I'm sure it's a plus versus a negative.
Yeah. Thank you, Commissioner Millsap. That's great. I just want to add a couple things. Construction season's picking up. So the Carpenters Union, we're always accepting applications online. If you go to www.ikorcctraining.com, you can follow a link on that website to fill out an application. We are starting to ramp up. We're going to be bringing in some members with the amount of work that's going on right now. And And then also, I got a conversation started today with the Michigan City chapter of the NAACP. They did a program. I was informed about this program through City Council Member Moldenauer. They did a Soul Power, and they did basically training for solar panels installation. And the Carpenters Union's doing a lot of that right now. So I'm looking at that as maybe another pathway for getting into the Carpenters Union, because we do have a big solar farm down in near North Judson that's just starting off, and that could be a 2-year project. So
Could you give that website again?
IKORCCtraining.com. Yes.
Mr. Chair, you guys also, the trade unions also work with Work One also.
Yes.
Work development.
Yep.
So anyone who's interested in trades can also go through Work One also. And people need to realize that that particular agency is the key. I mean, rather than you doing it alone, you know, you go there, you go through the intake process, you bring all your information, driver's license, social security card, etc. You get with a placement rep, and it's a process. But at the end of the process, it's a lot easier than you're waking up Monday morning and just flipping through the paper or
White paper.
riding around looking for
Yeah.
hiring now signs, whereas it's there for a reason, it's free, so there's no reason why you shouldn't tap into it. And once again, it's located 317 Detroit Street.
Also, I talked to the, Travis, what's Emmanuel's title?
Indiana plan.
So
He's
he's
the director.
the director for the Indiana plan. We're looking at doing a class in Michigan City in July, tentatively right now. We don't have a date, or I talked to him last week, we didn't have a date at that point. But I'm hoping to get a date hashed out, and then what the Indiana plan does is it's a 2-week training course where they introduce anybody that signs up to basically all the building trades and what each trade does. So you get a little bit of insight on what each of the trade unions do. And then by going through that 2-week program, that's already an accredited pathway into the Carpenters Union. And I believe some of the other trades have the same agreement. So personally, I think that's probably one of the best ways to get in. It's 2 weeks. You got to give up 2 weeks of your time. Yeah, and Mr. Williams here is a product of the Indiana plan, so I think that's all I have on employment.
And I noticed in his literature, employment is one section. that
Yep, they got the
work
same.
with. So that could be something that we can tie in to
Yep.
assist.
And we were talking about that earlier.
Oh, perfect.
We held a career fair or job resource fair in Indiana Northwest in Gary, and at that workshop we taught black men how to fill out a resume, how to dress, how to interview, and then we also had companies there who helped them and coached them through the interviews. Because a lot of them were like first time, looking for jobs. And then we also had a workshop on expungement. And so for those who wanted to get their records cleared. So, yep, so that's one
So
of the
that's
things that
something we can work on together.
Yeah.
All right.
Yeah.
Thank you.
Thank you.
All right, moving on to criminal justice. And then social factors.
I have a question about, you said social factors include health and what else?
Well, we look at social factors as anything that creates an obstacle for black men succeeding. So it could, for example, it could be mental health, it could be drug addiction, it could be something as simple as a new father who doesn't know, how to feed their child, how to change a diaper. It's basically anything that creates a barrier for them. So that's what we look at as social factors. It could be living in a area where there's no grocery stores, living in a food desert, and how that affects them.
So, we meet quarterly, so our next meeting will be in June, but I have not located, a location yet for the meeting. But Juneteenth is already planned out. The city, Michigan City, so we are a city commission, in case y'all forget that. And Michigan City has taken over planning the Juneteenth celebration. It's gonna be Thursday, June 19th at Washington Park, Guy Foreman Amphitheater from noon till 9:30 p.m. From noon till about 3 is primarily for the kids or whatever. They got all kinds of activities for the kids to participate in. From 5:30 on, they're gonna have live bands, they're gonna have a comedian, they're gonna have, it's gonna be nice. The people that they have are not cheap, and they are well-known people, which I don't have that list with me. But there's gonna be live entertainment, there's gonna be food trucks, vendors, game truck, and more. It's free and open to the public, and during the day, they're gonna have about like free hot dogs and hamburgers and stuff, basically for the first 200 people that come through. After that, you probably have to buy from the vendors. So I do have a flyer, a couple of flyers.
Thank you.
And so I will have them, I'll send out the meeting notice for the commission when I get it set up. Because it will be in June and it'll be before our meeting.
Okay.
Can we have a table? Sign up for,
That's up to the commission. We can't vote on it today because we don't have a quorum. But I guess we could send out an email and have people vote.
Yeah. Okay.
And
Just so
if
we're-
they want to have a table.
so we're represented as a city board.
But what do we have to give out at the table?
Information,
What information we have?
whatever we come up with. But at least, you know, you're there supporting, we're a city.
Well,
board.
we do have a meeting prior to the 19th.
We
Our
do.
meeting is,
The 11th, I believe.
11?
Yep.
I think it's 11. So, yeah, our meeting is the 11th and the event is the 19th. I could I could call and put in a
Because we have a banner.
possibility that we might have a table. I could do that, have them reserve it.
Yeah, we ought to do that.
Because we have a banner.
And then if we don't have it, we'll know June the 11th, so that's still before the event.
Right.
Mhm.
So I will definitely let them know right next door on the way out
Okay.
that we want to have a table.
Yeah. All right.
All right.
No, that sounds like a good time. All right, moving on, public comment? Anything?
Love me. Y'all doing a lot of great things here. I love what you guys doing. I really didn't have a comment, but he put the camera on me. But so like what Nick was saying, in the construction industry, work is picking up. You know, yes, me and Nick as representatives for the corporation, but we pro trades. We're all about opportunities, and it's opportunities out there for people that want to be electrician, iron worker, pipe fitter, whatever it is. The job opportunities out there. So like we talked about all these different resources for those people that's chiming in. Tune into it, like the Center of Workforce Innovations, that your DWD is, or it's all these different names. Tap into these free resources because they're out there for a reason. And it's unfortunate a lot of people don't take advantage of it. Just like the resources that you guys have to provide. Like, take advantage of these resources because different pathways for people to join organizations like ours. Like we mentioned the Indiana Plan. I'm a huge advocate for the Indiana Plan because I came through that program. Take advantage of stuff like that because it doesn't cost you anything. It's state-funded programs. I mean, that's stuff that we're all collectively paying into it for this stuff to happen. So we need to do great jobs at getting this information out there to the public. And like I said, I love what you guys do, and just keep the momentum going because he's coming in town to work with us. We need to do this stuff as a collective. So yeah, appreciate everything you guys do.
Thank you. Moving on to commissioner comments.
Well, I would just like to say that, for the new commissioners, that we do have a scholarship that we were offering. We didn't have funding, so for the education committee, if they can try to meet and look at the, criteria that was presented for the scholarship, and maybe next year we could get back into school and offer that scholarship to the students.
Yeah, I like that.
Well, I was sitting and looking at Swanson. Would y'all would be a part of the back to school?
Sure, we would love to do
Yeah.
that.
Okay. Because I think that's another way of getting info out to the public. Is through the back to school.
It's a fantastic event,
Yeah,
too.
right. Okay.
Anybody else?
Move for adjournment.
All right, we got a motion to adjourn.
Good.
Thank you.
Thank you.
Thank you.
And